I don't want to put words in Anthony's mouth, by the way, and I like him. Today I walk in, I hear I'm going to fire him. I'm not firing him. I think he's a wonderful guy.
Dr. Anthony Fauci,
Thank you very much, Mr. President.
the most trusted member of President Trump's coronavirus task force, a veteran of multiple health crises for 6 administrations, now embroiled in a political drama.
Trump retweeted this post from a former Republican congressional candidate that ended with these 4 words: "Time to fire Fauci." Hours earlier, the nation's top infectious disease specialist had acknowledged to CNN's Jake Tapper that shutting down the country earlier would have saved lives.
You could logically say that if you had a process that was ongoing and you started mitigation earlier, you could have saved lives. Obviously, no one is going to deny that.
The president has continued to lash out following an extensive report in the New York Times that documented his slow response to the coronavirus. The New York Times says senior officials urged Trump to impose social distancing measures long before he did, a detail Fauci confirmed on State of the Union.
We look at it from a pure health standpoint. We make a recommendation. Often the recommendation is taken. Sometimes it's not. But it is what it is. We are where we are right now.
His relationship with the president has been put under a microscope.
Tweet something that said fire Fauci. Why did you
fire Fauci?
I retweeted somebody. I don't know. They said fire. Doesn't matter.
While Trump has publicly praised Fauci, he has privately complained that he often contradicts him, and at times he's refused to let him answer questions. So he admits that statements Trump makes aren't always true or in line with his advice. Fauci told the journal Science, "I can't jump in front of a microphone and push him down."
Well, I'm cautiously optimistic about
For more than 30 years, Fauci has been the voice America looks to for a simple explanation of the scientific facts, unafraid to deliver a reality check to both officials and Americans.
I've served 6 presidents, and I have never done anything other than tell the exact scientific evidence and made policy recommendations based on the science and the evidence.
Now he's the most visible medical expert in the latest crisis, appearing on hundreds of TV and radio interviews. His stature as an expert in infectious diseases began in 1984 as a new and mysterious infection, HIV, appeared in the AIDS epidemic ballooned. At the time, the young scientist leaning on facts to reject ill-informed misconceptions that it only affected gay men.
this can be transmitted, this virus, by heterosexual contact from women to men as well as from men to women.
Advising President Reagan on the deadly virus, who for years refused to acknowledge the disease even as thousands died across the country. His work later recognized with the Presidential Medal of Freedom. In the midst of the bird flu outbreak in 2006, Fauci joined a choir of scientists concerned that a global pandemic was on the horizon. Then when Ebola struck in 2016, Fauci wasn't just a voice at the podium.
Thank you very much to the doctors and nurses.
But also donned his white coat, treating patients stricken with the virus, like nurse Nina Pham.
I'll never forget those images. He's in his white coat, and he has his arm around her. He's saying she is no longer a threat to you or the community. She is a human being. She can't give you Ebola infection.
Even when COVID-19 was barely registering with the public, Dr. Fauci had been sounding the alarm for weeks.
The issue now with this is that there's a lot of unknowns.
Fauci said that was the wrong choice of words and said the president has taken his advice.
I was asked a hypothetical question, and hypothetical questions sometimes can get you into some difficult. The first and only time that Dr. Birx and I went in and formally made a recommendation to the president to actually have a, quote, shutdown. The president listened to the recommendation.
With one poll showing 78% of participants approve of his performance, compared to the 46% who approve of the president. Fauci's assistant at the time, Dr. Margaret Hamburg.
This is a moment when we need him, we need his vision, we need his energy, we need his commitment.
因为危机还没有过去。
The crisis is far from over.
1 month to the day after New York City recorded its first COVID-19 death, the city's death toll has soared past 10,000.
At this rate, COVID-19 is killing as many New Yorkers in 3 days as the seasonal flu typically does in an entire year.
Things are just totally crazy right now. Everyone is COVID positive in these hallways. All you hear is oxygen.
But even during this darkness, some light.
While the death toll has topped 10,000 in New York State, ICU admissions and intubations are dropping. The number of newly hospitalized patients is the lowest it's been in 2 weeks.
The worst can be over, and it is over, unless we do something reckless.
To keep stopping that spread, today Governor Andrew Cuomo ordered all New Yorkers to wear face coverings in public.
All people in public must have a mask or nose covering, mouth and nose covering, and they must wear it in a situation where you cannot or are not maintaining social distancing.
We asked the mayor why now for the new rules on mandatory masks when the crisis seemed to be improving.
Is that not a mixed message for New Yorkers?
No. In fact, this is exactly the time to double down.
The mayor even extending his restriction on public gatherings to say there won't be lifeguards at public pools this summer because they'll be closed. And beaches, there's no scenario where big crowds can soak up the sun.
As the president promises new guidelines, states continue with their own.
Anthony Fauci says there's still a long way to go before going back to any kind of normal.
With the first thing and the only thing in mind as the health people here, my colleagues who are either physicians, scientists, or public health issues, the predominant and completely driving element that we put into this was the safety and the health of the American public.
New York, Los Angeles, Washington, D.C. all extended their stay-home orders another month.
What happens after then, I don't know. We will see depending on what the data shows.
It's so hard.
Michael Merritt is an ER nurse in New York whose patient died within an hour of getting to the hospital. He has this message for those who want the country to reopen.
I'm sorry for people that's suffering from unemployment. But I'm seeing so much pain and sadness and sickness every single day. I don't understand why they would even consider it. Not until we're in the clear.
The sirens across the city are never ending.
The typical job now is not the typical job it was before. I'm walking into a house and I'm seeing 3 or 4 family members who are all sick.
For Rodriguez, the struggle is now dealing with families, facing the grim reality some patients may never come home again.
We try to do the best to reassure the family members, but we also can't lie and tell them that they're going to be okay if we don't know if they're going to be okay. We just try to be honest with them and let them know that this might be the last time that they get to see their family members. It's hard to watch and then to have to watch it repeatedly.
还有比这更难受的工作。
Ariana Dumas is an ICU nurse at North Shore University Hospital who brings iPads to her sickest patients to help them connect with their loved ones.
I was holding the iPad and I was holding her hand and I'm hysterical crying and I'm in all my gear, so like my glasses are all foggy and I was just like, oh my gosh, like how am I gonna handle doing this for multiple people?
One of her patients died on Sunday.
Just holding his hand, playing the video, and crying.
This week, the hospital reversing its policies to allow some families time with their loved ones.
We decided to change it for patients where they're very near the end of life so that people don't have to die alone.
In New York, that there's enough protective gear for medical workers, New York City officials are now asking sports teams for rain ponchos to use as makeshift surgical gowns. The CDC says more than 9,000 healthcare workers have reported testing positive for COVID-19. Likely an underestimation.
We're at risk. The patients are at risk. Our families who we're going home to, they're at risk. The grocery store clerks that I go buy my groceries from, they're at risk.
Without this PPE, we won't need the ventilators because none of us will be around to run them.
We shouldn't be losing talented healthcare workers because of a lack of protective equipment when people are just showing up trying to do their job. It's wrong. I'm not going to give up. No matter what, I still love my job, and I'm going to do everything in my power to save lives.